All right, well then I'll just get started. Hey. Well, thank you guys for being here. For those of you that I haven't met yet, my name is Joel. I'm the executive director here at the space. Just a little bit about the space. We are a Bitcoin education nonprofit. We are fully member run, meaning that everybody who is a member here has a say in our governance. So any initiatives that we push forward as a group, everybody has a say in it, so that's awesome. We are currently waiting for our nonprofit status to be approved by the IRS. We submitted that back in February. We're just waiting to hear back. Yeah, it's stupid, but we're almost there. But if anybody's interested in learning more about the space, or if you want a tour, if you've never been here before, just come find me here in a little bit, and I can take you through that at the end. But thank you, everybody, for being here. We are super excited to have Dr. Noah. One of our members, Dylan, right over there, he was the one that told me about Dr. Kaufman, and we wanted to, I went and checked out the clinic about a month ago, or maybe 6 weeks ago. Everything is still there. Yeah, it's good. Oh, for me, yes, everything's fine. I'm good. But that being said, we're super excited about having Dr. Noah here, so I'll hand it over to you, sir. Thanks for being here.
Thank you, Joel. Yeah, and great to see everybody. I feel like I'm with my people, with my tribe. So, and yeah, first and foremost, I am probably the newest member here. So yeah, as of today. And you know, I moved back to Denver from Atlanta a couple years ago, and I immediately was interested in joining the space, and I have nonstop been so busy that I haven't been to. So it's been like a real interesting kind of time to want to come and spend time here. And now with the conference room upstairs, I think we're going to have a lot of opportunity to really use this space and be a closer part of the community. So I'm excited. But thank you guys for being here. Yeah, Hunter.
I gotta know, how many days a week are you on call?
Well, right now it's 5 days a week. We're open 9 to 9.
So it's 60 hours.
Yes, but I'm answering texts after hours, and yeah, it's been 60 is just the hours in the clinic, but it's been nonstop work opening this thing up, and let me get a little bit of story out there and tell you how we got here and why we opened this clinic. I've been an emergency medicine doc for about 23 years now, well, for exactly 23 years, and I went into medicine because when I was 2 years old, I had a Fisher-Price set that my parents had with the fake needles and the fake stethoscope, and I would play doctor, and I knew that I wanted to be a doctor when I was 2 years old, and that is a true story. And over the years, that desire, the reasons I wanted to be a doctor changed, of course, and I learned a lot. And being the eldest of 3 brothers, I was in and out of the emergency department all the time. I mean, I had stitches, I had broken bones from my brothers hitting me in the wrist with a hockey stick. And, you know, every time I was in the ER docs were so calm and cool and collected, and they were so cool, and they just sewed me up, and they showed me what they were doing, and they taught me, and I was like, this would be really cool. And I got into rock climbing when I was 16, and, you know, in medical school, there's an old trope, which is, you know, your personality kind of selects what kind of doc you're going to be. If you're a jock, you know, like, bone broke, me fix, you know, like, what's the purpose of the heart? To pump the antibiotics to the bones, right? And orthopedic docs, some of them are my best friends, and they're like really smart guys, but they're jocks, okay? Muscle-bound jocks. Neurosurgeons, exactly what you think. You know, psychiatrists chasing their own problems. I mean, for the most part. ER docs, we're adrenaline junkies. So I own 5 motorcycles. I'm a rock climber. I have free soloed in Yosemite. Like I got stories upon stories, and unfortunately today is not a time for those stories. But I went into medicine because I wanted to help people. And, you know, growing up in this society, you start to really get sucked into money at an early age. I mean, we're in a society that is predicated on wealth and status, and that's just the way it is. And we're part of, you know, the most amazing empire that the world has ever seen that has brought forth AI and iPhones and stuff, and this might be of dubious value. I mean, maybe it's better to like be old world and enjoy pasta, you know, and spend hours, you know, making dinner like the old like they do in Europe. But suffice it to say, we have done something really horrible in this country, which is we have taken all incentives and laser focused all incentives on progress and profit and money. And what has happened because of that is it has muddied a lot of waters and professions and whatnot. So I went into medicine to help people, and for 23 years I've been in the ER in the hospital, and I've been a part of a system for a long time that is doing massive financial harm to people, massive. And it's not okay. And you know, I think like 60% of bankruptcies are associated with medical debt. You come into the ER to see me, and you know, let's say your shoulder's dislocated, you were skiing. It hurts, I inject your shoulder, I reduce it, okay, you can move it, great, I put it in a splint, I never see you again. I have no idea what it costs. They don't tell us. So if you ask me, well, you know, hey, Noah, what does this cost? I say, oh, I don't know. You'll have to ask billing or whatever. And then what happens? Well, they get the radiology bill for $2,000, then they get the facility fees, $3,800, and then they get the ER doc, which is $4,000. By the way, we see like maybe $20 out of that. And like and it's been a consolidation of hospitals and insurance companies that are getting bigger and bigger and bigger. And what is everybody incentivized to do? Make money. And so being a part of that system is really hard on us morally, ethically, and it's not okay, but we have what we call the golden handcuffs, right? Like we make $300,000, $400,000 a year. We have to pay off all this debt from medical school, because we get out of medical school, we're 32 something, we've got $500,000 in debt. And yeah, we like start buying stuff and we have nice homes, but you know, like, and I'll tell you, I'm making the same thing. Well, I was making the same thing I was making, now I make nothing. Because I opened a clinic and I'm liquidating my Roth, but you know, like we get out when we're 32 or 33 or whatever it is after residency, and we're paying off loans and stuff, and we get trapped into the system. And as ER docs, we're hospital-based. So suffice it to say, we're mostly unwitting accomplices in this horrible system, and it's just the way things are, and things are getting worse and worse and worse, but we're at this inflection point. And this is like a peak fiat kind of symptom and disease, right? And so, you know, I wrote a book called Self-Bitcoinization, and in my book I've got a chapter about health, of course. That's what I'm focused on and interested in. And I'll tell you this, when you create a system that robs people of value with a currency that is constantly losing value, like the melting ice cube, what do? You incentivize people to grift. You incentivize people to try and make more money, to step on each other, to, you know, and to compete for resources. You're in a totally scarcity mentality world where you're just forced to try and make money, to pay off debt, and you're forced into debt, and that's just the way the system is. Now, Bitcoin, of course, offers a much better solution for this and accepts abundance and makes everything more collaborative instead of competitive. That's a slightly of a side story from medicine. But medicine right now is suffering because we're kind of at the end of this like huge empire experiment of America in a way, and the currency is failing. There's cracks in the foundation, and we're seeing crazy, you know, we've seen 99% of loss of the value of our money. And everybody, so, you know, think about it this way. If you were designing a system de novo from scratch, if you were designing a system from scratch, like a society, and you wanted people to be well taken care of, like healthcare wise, why would you ever create a conflict of interest where the people providing health care need to make money, want to make money, and are forced to make money, and that's in direct competition with what they really should be doing, which is focusing on health outcomes and on people's health and on making people better and caring for people compassionately. So we have compassion fatigue, there's moral injury for physicians, and it is like a huge disease. And it's a fiat disease, it really is. And right now, the suicide rate for physicians is double that of the normal population, and there's a lot of problems. And I think a lot of, like, as a Bitcoiner, and I'm, 2015 was the first time I started into Bitcoin. I really didn't learn about it until 2018, and then COVID, I really went all in and figured it out. And I went through all the things, but as a Bitcoiner, that gives you that vision and helps you understand, what, like the veil that was over your eyes when you're living under, like in a fiat paradigm. And it helps you realize that there could be a better way. So back to medicine, we are either complicit or, either witting or unwittingly complicit in this massive institution that's doing great financial harm to people. So I had to stop. I couldn't do it anymore, and especially as a Bitcoiner, and I packed away, I stacked some Bitcoin, and I finally decided I was at a place where I could take a risk. And also I'm a patient now, I joined Crowd Health, and so if anybody's interested in Crowd Health, we can talk about that, but so I need to get my back fused, which is a whole nother story, but I got to see the world from the patient's perspective too, seeing neurosurgeon and then orthopedics, getting crazy bills, and like, they wouldn't, I wouldn't know how much stuff would cost, and then, I mean, it's just insane. So in any event, seeing it from the patient side also made me realize last August that I need to do something. So what did I do? I created something in my lane that, like something that I can do, okay? Many of you have heard of direct primary care, and some of you might have heard of direct surgical care or direct specialty care, which is like Smith Center of Oklahoma. Right now Surgical Center of Oklahoma, we have Smith Center for Smith Surgical Center down in South Denver here. But I created the DAC category, direct acute care. And so basically my role is to keep people out of the ER, because the ER is the #1 unexpected cost for people. Like it's crazy. You go to the ER, and what happens? You wait for 6 hours, 7 hours, 8 hours, if you're lucky. I mean, if you're really lucky, you go at the right time at 6 a.m. and you get in, and it's like an hour wait or something. But you go in, you wait, you see an ER doc who's been trained, but they're fatigued and they're working really hard. You get really top-notch care, but then what happens? Nobody knows the cost. You don't know the cost. Different insurances have different costs. If you're cash pay, you get some huge discount, and you guys have all seen the posts and stuff. If you're insurance, you got to pay your deductible, and some deductibles are $5,000, $6,000, $7,000 or more. Some are over $10,000, and most people don't even reach their deductible. So almost everybody's cash pay anyway. And what is the insurance company trying to do? The same as the hospital systems. They're trying to get bigger and bigger, and they're trying to optimize for profit, okay? None of this is like shocking, we all know this. So they're all trying to optimize for profit. But coming back to my question of if you were designing a society or a system that took care of people with our best science, our best compassion, first you'd want those people to be really happy. Like you'd want your doctors to be, or your healthcare team to be happy and want to take care of you. And that's where I'm at now. It's wonderful taking care of my own patients in my own place. But second, you wouldn't want them to be going after money, okay? I will tell you that as an ER doc, if somebody had a cut on their arm, if it's less than 2.54 centimeters, it's like, I don't know what it is, it's $230, let's say. If it's right over 2.54 centimeters, it's $780, okay? And it's that big of a gap. And so what do you think happens? Okay, we get rewarded as doctors from RVUs and stuff Do you think there's any cuts that are under 2.54 centimeters? There's none. Let that sink in. No doctors yeah, maybe like 1% of doctors are like measure it. And then by the way, you're allowed to stretch it, and this is like actually what we're taught and stuff. Well, when you're documenting, you know, like, and the way, and so you would think like medicine was always one of the more noble professions, right? And so you would think that like out of anyone, doctors would have integrity and wouldn't want to lie and, you know, try and optimize money over somebody's health or over their, you know, income or whatever. But it's not that way. There's a lot of grift. And I can tell you that I was a part of it. Like we would, for so many years, like the template, when you write a note, there's so many notes and they make it so complicated. You got to spend so much time writing your note that it's that, you know, when you write a note, it's auto-populates. And we can't control that. That's like Epic. That's like the computer program that we use. And so we would have to go in and line by line, and they put it in different categories. You would have to go and delete things. It's just easiest to not do anything. So like for the heart, it'll say like, you know, no murmurs, rubs, or gallops, which is like a finding that you would have when you listen to the heart with a stethoscope. With the lungs, it says clear to auscultation bilaterally. Well, if you got an ankle sprain, did your doctor listen to your lungs and your heart? No, but they documented that they did. And they don't even have a choice, because if they don't, this is what happens. I'll never forget. And I did this too. And like we didn't have a choice. It's like forced corruption, forced fraud. And so it tears at your heart, because you're like, what am I doing? You know, like, but what can I do? But like they'll come and talk to you, and they'll say, you know, we noticed that you've been changing your note and you're not documenting all these physical findings of these other areas. What if you missed something? Well, they came in for an ankle sprain. Well, but they're in the emergency department, so you need to rule out an emergency. What happens if they had a blood clot in their lung? But they came in for an ankle sprain. I mean, come on. And so what happens is we level out things. We go level 1, level 2, level 3, level 4, level 5, and then critical care. And each one gets a basic billing code. And the complexity and the obscurity, I mean, it's insane. And they obfuscate prices. But I will tell you that in the ER, there's almost 0 level 1s that are ever charged, almost 0 level 2s, some level 3s with ethical doctors, and then level 4, and we don't even select the level, we just chart, and then someone takes our chart and says, oh, they listen to the heart, they listen to the lung. So the fraud is rampant, it's everywhere. And when you go to the ER, you get a $5,000 bill now all of a sudden for an ankle sprain. It's insane. So okay, so you got the ER. The ER is long waits. It's very high level of care, because you got board certified ER docs who just dedicated their life. It's hard to get into medical school. We studied 120 hours a week until we were, okay, so fine. So the ER is a great place to get care if you get a good doc, but you're going to spend a ton of money and wait a long time. So what else do you have if you cut your arm open, you cut a tendon? Well, you go to the urgent care, but the urgent care is a race to the bottom. It's owned by private equity now, everybody, and it basically hires mid-level providers, some of which are very good, some of which I would let take care of me and my family. But there's a huge variability in the training, and it's oftentimes people who've had 2 years of training and they won't take care of that much stuff. So as an ER doc, I would always get people from the urgent cares. They just kind of fed people to us. So they'd get charged at the urgent care, and they'd be paying cash, and then they would get charged at the ER through the nose. So what we did is we created this third category that's between the ER and between the urgent care, and that's KaufCare. That's what I put my name on it because it better be the best thing that I can possibly make for the best reasons. And you can ask Danielle, like, if people can't pay, I'm taking care of them. Like, you know, I'm like, and we got to keep the lights on still. And I haven't even gotten to the part where, you know, we take Bitcoin and all that stuff. But we have cut out the middlemen. We are 70 to 90% cheaper than the ER. We've bought all the medications so we can just, because when you see a doctor, you get a prescription, you got to go to the pharmacy and wait in line, or you got to give it to them, and it'll be ready in 2 hours. And so, like, we just give the prescriptions right from there, and I get doctor prices on the medications, so it's, like, cheap. So, like, we give prescriptions right from KaufCare because it's the right thing to do, and it, like, makes sense. Like, I'm not trying to put the pharmacists out of business. For all the drugs that are, like, hardcore, or if you need cancer drugs or diabetes, some drugs that we don't carry, but for a UTI or for pain control or that kind of stuff, we carry all the medications for our patients. We have X-ray, we have ultrasound, so we do these things that the urgent care won't do. Like we've ruled out multiple blood clots in the leg, so every time you're concerned about a blood clot, we've diagnosed multiple fractures. And so we do a lot of stuff. We've opened up abscesses and done minor procedures. And we do a lot of stuff that the urgent care won't do, and we save people thousands and thousands of dollars from the emergency department. We don't take insurance. And so that allows us to remove, I was talking with Jason about this before, like in Japan, there's like one person who is the administrative, they take your ID and they get you registered. And that's how it is at KaufCare, and we're a family. And Danielle is that person. You guys, Danielle, she's amazing. And, we have one person. We basically have, we have 3 employees, but we have only, 1 to 2 people on at any point in time. And so there's almost no overhead. And of course, my goal is to give these guys the raises they deserve. But our focus is solely on health outcomes and compassionate care, and I can't tell you how good it feels. It feels so good to practice medicine without, the need to answer this poisoned system. And so it's resonating with people. And like I said before, the direct cares, the independent physicians this is the way it always was for 100 years or for 100. You had a doctor, you would go into the doctor's practice, you would see them, they would lance a boil or something, hopefully they wouldn't do too much bloodletting, and there's still a lot of BS in medicine, and there's a lot of docs who act like they know everything, and it's really important to be able to say, I don't know, and so just as a point of overall advice, if you ever have a doc who isn't willing to say, I don't know, medicine is totally probabilistic, and we all look different on the outside, we all look different on the inside, and as docs, we're compassionate guides who know some stuff, but we all have ChatGPT now, and I think it's great when it calls out all the bullshit with all the, and excuse my French, but with all the physicians who act like they know what they're doing, and their patients are well, that's not what I read. And good. So I love when I tell my patients, I'm gonna take a picture of this, feed it into your ChatGPT, double check what I'm saying, but even in that regard, I know what to ask the chat a little bit better, and so that's part of what my value is, besides the procedures and stuff. But so there's been this kind of renaissance. We're at this inflection point, this flash point, where doctors are fed up. We're part of this system that is doing great financial harm, and we're leaving the system. Some of us are leaving by suicide. Some of us are leaving to go become influencers and shill, crazy new supplements. Some of us are starting tech companies. Some of us are going back to our roots and starting medicine the way it should be. And this is the way medicine should be. It should be direct between 2 people, and it should be honest and transparent. And we publish all of our prices online. There's an ER comparison tool. We list everywhere where we got the data, and we're very conservative. When we list, so for example, you can check what like an abscess costs. Well, an abscess can be a big complicated procedure. It's a big infection pocket. And it can be under the skin, it can be near vital organs or blood vessels. And so there's a lot of skill and technique, and you got to pay, and there's the knife and antibiotics and all this stuff, the packing material. And so an abscess, we list an abscess for a certain amount, it's hundreds of dollars. I don't even know what it is. But we had someone come in today, they had an ear abscess, a teeny little abscess from an ear piercing, okay? It's my clinic. It's Danielle's clinic. We get to say what we want to do. We said, okay, well, look, this is a small one. We're going to say, this one's 25% of we'll do it for you for this. Help us keep the lights on. And I literally told the guy, I was like, do you have chickens? Give me some chickens. But, we made it right for him, and he couldn't get that lanced anywhere else. They wouldn't have done it at the urgent care, almost guaranteed. And if he had gone to the ER, it would have been a $6,000 bill. They would have maxed out, guaranteed, because the incentive structure. Like if I had it my way, I would say, okay, well, medical school is free. It's really hard to get into. And by the way, I'm leaving out the whole AI thing, which might change everything. It's part of the reason we are very procedurally heavy, because we're probably safe for 3, 4, 5 years from the machines. Like, you're going to want an artist like me. I treat it like an art. When I sew you up, it's like I'm sewing up my kid, and that's the way your doc should be. They should take their time. It should mean everything, that moment, that focus. This is your life and your body. This means everything. And your doc better be like so honed in and locked in on providing the absolute best care they can, and then perfecting their art so they can give everybody the best care they can. But, so suffice it to say, we opened KaufCare to do the right thing, and it's resonating with people. It's really exciting. Our reviews, the reviews are insane. Like, I don't know if you guys, I just want to read one to you, because it almost made me cry. And it's worth reading, because what we're doing is so powerful, and we plan to. I'm not just doing this as a one-off. Like, I want to change healthcare. I want to change the system. I've seen so much death and craziness in my career. People torn in half, bullets ripped through faces. I've seen everything over a 23-year career. I can't tell you. I mean, I've lost babies and kids, and then I've saved so many lives, and it's just crazy. And being a doc at this point is my calling. And I was real lucky to get into Bitcoin, because I have a cushion, so not all docs can do this. But we want to create a way for docs to be able to provide the care that you don't go into medicine to make money. I mean, maybe you do to be comfortable, but docs are mostly smart enough. They could go into investment banking. They could, docs could go into all sorts of stuff. But let me read this to you. And she probably used AI to help her craft the perfect review. But I cannot say enough good things about this clinic, and especially Noah. I came in terrified after dealing with infected stitches from a dog bite on my face, and I was overwhelmed, emotional, and scared of what was happening. Instead of feeling rushed or dismissed, I was treated with such kindness, patience, and genuine care from the moment I walked in. Noah sat with me, talked everything through, answered every question, made sure I understood what was happening and what the treatment plan was. He was incredibly knowledgeable, but what stood out more was even his compassion. At one point, I started crying, and the nurse quietly handed me a tissue and reassured me with so much warmth and humanity. That small gesture meant more than they probably realized. This clinic's approach is exactly what healthcare should be. They make people feel safe instead of scared. They make medical care feel financially approachable and emotionally supportive, which is something so many people desperately need. I truly hope other doctors and clinics take note of this practice and the way they treat patients. I walked in frightened and alone, and I left feeling calmer, informed, cared for, and hopeful. If you are nervous about seeing a doctor or getting treatment, please go see Noah. This kind of care changes people's lives. Thank you. And that was that's worth more than, yes, yeah, it feels good. It's an ego hit, right? I'm happy that I was able to deliver that care, and it's nice that she said all those nice things about me, but it's my team. It's Danielle, it's T, it's Kathy. And what we're building here is all came out of the confidence and the philosophy and the understanding that I have that I've gained from studying Bitcoin, honestly, and decentralization and an egalitarian money system that doesn't rob people of value. And so, you know, in my book, in this book that I wrote, Self-Bitcoinization, we always talk about hyper-Bitcoinization and what happens to society and what happens, you know, but what about what happens to us as people on the inside? And so, you know, Abraham Maslow talks about self-actualization in the hierarchy of needs. And you need a roof over your head to be healthy, and you need to be healthy and, you know, to be in love with yourself and maybe with others. And then at the very top of the pyramid is self-actualization. And so the bottom line is, I think that right now, you know, the psychologists and the studies that they do, maybe 1% of humans are self-actualized and have all their basic needs met so that they can read books and pontificate and philosophize and become better people and better versions of themselves. And that's 1%. And I think the promise of Bitcoin is that people will live with abundance, and that we can all, you know, utilize in a collaborative way an abundant world, which is truly abundant. And, you know, at some point, hopefully energy becomes abundant. But, you know, I think at some point, I mean, how great would it be if medical school was free and we selected these compassionate healers who wanted to be doctors more than anything and were super smart, because I want a super smart doctor who's like really good with their hands when they do my back. And like, what if we selected, you know, those people through the ways we select them? We take tests and then what if we said, okay, medical school is free, and guess what? You get done and you never have to worry about money. Here's a card. You've got, you know, within reason. You can't go buy jets and yachts, but you're never going to make money in your career. You're just going to take care of people. That's the system I would have made from the beginning. And whatever you want to put a fiat dollar amount on it, so somebody gets out, you just give them $30 million, whatever. It doesn't matter. Take away money, you know, and I'm not saying, I don't even want to focus on the money. What I want to focus on is the toxicity and the conflict of interest, which is having an incentive to make money when you're a doctor and a healer. So what do? You know, like, and it's interesting getting out. In the emergency department, I did everything. I never thought about it. I think you need an IV. I'm going to do an IV. I think you need these medications. I'm going to do an ultrasound. I'm going to get an ultrasound. I'm going to get a CT scan. I would get like all these things. Now, I'm talking with patients. If I really think they need it, I'm like, I think you really need this. I highly recommend this. But if I think like, oh, you could pass on it, then, you know, okay, we could give you a steroid injection in your knee, but like, is it really going to help you? You could also take some NSAIDs and use ice, and let's see where you're at in a couple weeks. And like a lot of times, less is more. But when you interface with medicine, and this is like a good warning for everybody, when you're a hammer, everything is a nail, right? So if you go see a surgeon, what are they incentivized to do? They want to do a surgery on you. So, you know, even if, and yes, there's a lot of really good, honest surgeons who will be like, I don't think we need surgery right now. And yes, there's standards of care that protect patients, but more often than not, more gets done. And then there's the legal system and obviously legal risks that we have. So anyways, I'm going to put a pin in it there and open it up, and maybe we can take a little break, get some refreshments or whatnot, and maybe do some question and answers if there's any kind of pressing questions. I don't know, Joel, do you have any thoughts or ideas? Like a 5-minute bathroom break or something? Yeah. But thank you guys for listening, and really, really appreciate everybody. And we take Bitcoin, you know, like I didn't even talk too much about that, but it's an important part of what we're doing in creating circular economies and stuff. So we'll talk in a second.